you today? Can you, if you just start your video so I can see your pretty face? Oh, there you go. Oh, nice. How are you? How are you, Mrs. Woodley Arensmate?
Good morning, Apoku. I'm well, thank you. How are you?
I'm great. I'm feeling, yeah, very happy this morning because it's my daughter's birthday today. You know, she's 18. She's all grown up now. It feels like she was born just yesterday. You know, but there we are.
Yes, happy birthday to Amy. Hope she has a fantastic day and lots of love from all of us, from me, Ferdy, Shreya, Aryan, and Sitara. So hope happy birthday to Amy and hope she has a wonderful day and wishing her all her dreams come true.
I can promise you one thing. I know she's gonna have a great day. Because she's that type of person who makes you know, the best out of the worst situation. If you know what I mean.
Yes, I know.
For Amy, it doesn't matter if it's lockdown or not. She's gonna have a great time.
Amazing.
Really
That's
good. I like that
fantastic
about
to
her.
hear. And yeah, I mean, wow, what a milestone. And you and Sika must be very proud of her. So
Oh yeah, absolutely proud. I've got a big fat head this morning because my head is getting swollen because of all the tributes pouring in. Well, not tributes, like, you know,
messages
well wishing and people just texting, calling to wish her happy birthday and saying all the good things about her and all that.
Oh, that's amazing.
So, it makes us all proud as parents. Makes myself and my wife very proud as parents. And yeah, that's it really. And I just got a text from Jeff White as well, wishing Amy a happy birthday. And thank you very much, Jeff, and your beautiful wife, Sue, for the well wishing. And everybody else who's done that this morning from midnight, you know.
I know. I think I texted you after, but before midnight, actually. Yeah.
You were the fans. Yeah. Amazing. Thank you all very much. Thank you so much. Anyway.
No, I missed our show yesterday, so I just thought, let me just message you and see whether because I knew it was Amy's birthday, so what was in store. So hopefully Amy has a fantastic celebration and we're wishing her well. We are well. Easter was wonderful. Easter egg hunts and just pickled fish, South African favorite, and lots of drying and barbecuing. Yeah.
All right. That's cool. We had a good Easter as well, you know, even though it was mainly indoors, but it was great. We had a great time. And since we are allowed to visit now, you know, we went to see my nieces in Milton Keynes.
Yes, you did say.
One of my nieces, it was her birthday, so we just got together in the garden and had a great time. It was good.
Oh, amazing. That's lovely. Hope she had a lovely birthday. I think that's what most people are doing. They're meeting up in the garden. We met up with our friends in Oxford as well. We went over the Saturday and that was wonderful, also in the garden. I think everyone's doing the same thing. You know, if they're meeting up, they're just making sure that they're either meeting in parks or in gardens and just staying safe. I think that's the main thing. But it's good to hear that obviously lockdown measures are being eased. The numbers have gone down dramatically. So we've had the lowest, I think, 19 deaths on one of the days, so that's quite significant. But the numbers definitely have gone down. So yeah,
that is really good. You know what? I was looking. I was watching the Prime Minister yesterday.
Yeah.
On telly, and he was talking about, you know, the easing of the lockdown and all that. And I thought that, to be fair to him, I think I think that the plan for easing us out of lockdown gradually is a really good plan. That's what I think.
Yeah.
You know, I think it's a good plan. That, you know, the way they're going about it systematically. And for example, you know, from next week Monday.
Yeah.
You know, pubs are going to be open, but it's going to be an outdoor thing, wasn't it? And then hairdressers, gyms and all that. When I say hairdressers, I saw a smile on your face because I know you can't wait to go to your hairdresser.
I know I've been doing my own hair, must I say that. But yeah, I think a lot of people, not just me, a lot of people will be looking forward to going back to the hair salon and being pampered. Yeah, so Boris Johnson has confirmed that, according to the roadmap, that they're sticking to the plans and with the easing of lockdown on the 12th of April, with shops, gyms, hairdressers, and beer gardens to reopen as planned. So he was speaking at the Downing Street conference yesterday, and he said that so they're looking at the data, the COVID data, and according to that, there's plans for easing of lockdown, and that the government will might still have to extend foreign travel past the 17th of May because of the situation in other countries. So that's not good news, I would say. So that obviously is a concern. The vaccine passports also. So I think they were doing where they were looking at a traffic light system to put into place with red, amber, and green ratings for the different countries, and also the vaccine passport, which they are piloting in certain areas. So I think obviously that is a concern. So
The COVID passports or the vaccine passports.
I think vaccine, yeah, passports.
Sorry?
Vaccine passport, yeah.
All right, okay. On the news, they're saying that criticism
They did rule out that.
Is there a difference between the vaccine passport and the COVID passport?
Well, I think it's the same thing.
Yeah.
Yeah, it's the same thing. So they were looking at obviously the COVID passports and the vaccine passports, which we're looking at whether people obviously have had the vaccines, because they were talking about it being implemented in pubs, and then obviously they started to talk about it again in terms of travel. So there is still talks about it. I mean, they haven't ruled it out. And I think it's I think when we spoke about the pubs, they said by July, August it might come into effect. So in terms of the vaccine passport, just to say, Boris, so what they're saying about the vaccine passport, I'll just read that up. And what they're saying is that with the vaccine passports, we I think that they're going to look at the options of whether people need to have the vaccine passport. So I think in terms of, because children wouldn't have had the vaccine yet, would they? So I think that's what they're looking at. So they're saying that.
Well, they're saying that the second government documents that were released yesterday did say that such certificates that proves if someone has had a vaccine, has tested negative or has immunity, that means the person has had COVID-19.
Yeah.
We're likely to become a feature of our lives. And the Prime Minister didn't rule that out on Monday, did he?
No.
He didn't rule out that idea. And, the MPs have criticized the plan, with senior Tory backbencher Mark Harper calling for a vote on the issue.
Yeah.
And they're saying that the idea of coronavirus status passports was originally understood as a way of opening up international travel. But the UK government is also considering whether they can be used to reopen life in England.
Yeah. Yes, I think they were saying that for theatres, nightclubs, mass events, for festivals, they were looking at the application of maybe COVID certificates to help manage the risk where there are large numbers of people brought together in close proximity. So obviously, I think there's so many as we discussed last week, there's so many ethical, logistic, and challenges with the immunity passports and the certificates. But I think that this is going to obviously be something that is going to be on the plans. I think they're going to be discussing it a lot because obviously
they actually they're thinking about carrying out some sort of
a pilot.
A pilot to see how it could work, and they are going to be trialed at upcoming events, which includes the FA Cup final.
Wow. Yeah.
So we'll see how that will work out.
Yes. And like other countries, as we spoke about, I think Japan, China, and some other countries, they're also looking at the digital and non-digital routes. So there might be.
What does that mean?
So I think it might be that. So for example, maybe with your fingerprint or with your passport, that might be a digital. So whatever's on your record. We've done the census recently, so maybe they got a lot of information from the census. So whether they're going to use some of that information together with just using our details from our GPs or details from our thumbprints, fingerprints, to say that, okay, so there's a digital record that we've got our immunity passport. So it could be digital on the computer system. Well, that's going to be a massive rollout if that happens, and it is possible that might occur. So it will save people from having to carry a physical immunity passport. So obviously they're looking at this because it's a lot of risk, and there's also the ethical challenges, the logistic challenges. So yeah, there's so much to consider, isn't it?
Yeah, there is. So my concern really is on the fact, or about the fact that there's certain people that will not get the vaccine for different reasons. Could be health reasons, or maybe they're on certain medications, and they can't, they can't take the vaccine, or maybe for religious reasons, for other reasons, they don't want to. And so there is that fear that they will be isolated. I mean, they can't go to certain places, they can't, because they decided that they're not taking the vaccine.
Well, this is it, and this is going to be difficult because, I mean, whether they're going to use the COVID-19 immunity passport or the COVID status certification, which allows people that have had a negative test within the 6 months to return to theaters, football matches, cinemas, and other events. I think it's gonna place a lot of pressure. So it's going to be a situation where people are obviously either going to have the vaccine, or maybe there might be reasons where they're going to be exempt from it. So they might, of like you just suggested, these people that might not take it for religious reasons or for medical reasons. So the pilot, Boris Johnson said, will check the effectiveness and transmission risk of the government reopening plan, and starts on the April 16th at Liverpool's Hot Water Comedy Club. So that's one of the events. And as you said, the FA Cup, that's going to be, yes, a final at Wembley. Yeah, I knew that was happening because I read about that. And then the snooker championships in Sheffield, and and Luna Cinema in Liverpool. So they're going to try that out there. And so yeah, that's going to be huge, isn't it? It seems like quite a huge, in which is obviously running parallel with the immunization and the vaccines rollout. So it seems like it's going to be a lot. So I think what's going to happen is, if these people are going to attend these events, if you're planning to attend any of these events, you will have to have a pass the the national certification system, which means that you need to have a negative test within 6 months. And I'm not sure about the vaccine, whether you're going to have to show about the vaccine as well.
Well, from all indications, if you've not been vaccinated, you would have to have a negative COVID test.
Yeah.
Or which means that you must have had COVID-19 in the last 6 months or something like
Yeah.
that.
Yeah.
Right. The other
Sorry,
thing I
just
wanted-
to say that the government stressed that passports will not be needed to travel on public transport and enter essential shops. So just to note that.
Yeah, and even in pubs. Like, I think the Prime Minister mentioned something. I might be wrong, but I think he mentioned something about the fact that you wouldn't really need a passport, a COVID passport, to go
Yeah.
into a pub or to get
Yeah.
served in the pub. Anyway, the other thing I wanted us to talk about, which I think is a really good idea,
Yeah.
is the fact that we're going to have lateral flow test kits sent to everybody,
Yes.
so that everybody's going to test twice a week.
Twice a week for adults.
Twice.
Yeah.
I think that's a brilliant idea. You know, I think it's amazing. I mean, if we're all going to do it faithfully, that would really help.
Yeah.
You know,
So that
would
is a
really help.
huge rollout again. Yeah, it's quite, I think there's been sort of mixed views on that. Some people are quite happy about it because obviously, you know, the more that we get tested, from the outset when COVID came last year, you know, the main thing was to get tested and to have the PPE. So in terms of identifying whether people have COVID-19 in order to reduce the transmission, it is excellent idea to have that so everyone can get tested. So people are going to have to get tested twice weekly. And there's kits that's either going to be sent or you can contact the government check on the government website.
I was actually going to ask you, how do we access these test kits? Is it going to come from our GPs, or do we walk into pharmacies and collect them? I don't know, because the Prime Minister said that they were going to be free.
Yes.
So then I asked myself, how do we get them? Because if they're going to come in twice a week,
yeah,
we need them twice a week. You know, for example, we've got 3 people in my home, and so we should have. Anyway, my wife tests twice a week. We do that, not just her, but you know, we do tests twice a week, of course, because of a job at the hospital. But the question is, how do we get these tests? Do you have any idea of how we're going to collect them?
So the COVID tests are going to be offered, as we said, it's going to be offered weekly, twice weekly to all in England. So that means that within 30 minutes, the test would be available. And it's free at testing sites. So you can get it free at any testing site, pharmacies, and through the post. So there's 3 ways in which you can get it. So obviously, workers will obviously be getting those rapid home COVID tests. So you can get it through the post. So you go on the government website. So there's kits available from the 9th of April. They were available. They are going to be available from community testing sites operated by local authorities, from collection from nearby PCR tests site during specific time windows, existing work programs, testing programs, online home ordering service kits, which are delivered through the post, and participating pharmacies where a box of 7 can be collected to be used twice a week. So these are the ways in which you can get it. So I think it's about checking which is a local testing sites, PCR sites, your GP, as well as pharmacies, and then the online post. When I looked when this came out, I think it was on the government website how to actually get it in the post. But I can confirm that in a bit, so we can just check.
And the question I would want to ask is, if we are supposed to go and get them, like from the testing sites, from our GPs and all that, does not leave, you know, the possibility of people not doing it. You know,
well, I think there's a possibility that there's a possibility, obviously, that people might not. Everyone might not be able to, and I think there might be like different reasons how you know, people are going to react to it, because some people it might not be possible that they have to go and get it done. And also with, but I think they've made different ways in which it can be accessible. So it's not just by collecting it, it's also by getting it through the post. And also,
Yeah, but you have to ask for it. You have to go online and
yeah,
order it. Yeah,
yeah,
that's where I'm a bit. I'm not too sure about that, because if you have to do it yourself, there are a lot of people who will decide, oh man, I can't be bothered.
Yeah.
But if the government, of course, if the government sends it to you, whether you like it or not, there's also the possibility that you'll have it and it'll be sitting on the shelf or sitting in your somewhere, and you won't do it. But I believe that will be a better way of doing it. I mean, there's a bigger possibility that you will do it if it's sent to you, whether you ask for it or not. But then again, I think the government has a plan, and so let's just believe in our government and watch them work.
Yeah, if you go, exactly, I understand your point. If you go on the government website, which is where I've seen it, on www.gov.uk, and you /order, you can order your kits there. They'll have all the information of who needs to get tested and also different ways. So if you put your postcode in, you would be able to check whereabout in the country you would be able to go and get the self-test kits or the home kits or the local pharmacies. So there's different ways of getting it. I think, I mean, obviously, totally. It's going to be a lot of motivation. It's encouraging people, motivating them, and as to why they would need to get tested. In the case as you described, where some people might not be able to go and get the testing kits, or might not feel it necessary to get the home testing done.
Right. Thank you very much. We'll soon do the numbers, but before we do that, can you please, if you can, run us through the ease of the lockdown? This how it's going to work out from the 12th of April.
Yes.
And then, on and on. Yeah.
Okay. So from the 12th of April, Boris Johnson obviously has announced it's the next phase of the third part of the lockdown, easing of the lockdown. And so this will mean that what we can do from the 12th of April is that this is what we will be able to do. So the rules are that, so it's stage 2 from 12th April, where more businesses will open, but indoor settings should be visited alone or within household groups. Outside, 6 people or 2 households can meet. So you can meet outdoors. So from the 12th of April, they're saying 6 people or 2 households can meet. So all shops are allowed to open. So this is great news for everyone, isn't it? All the shops, the businesses, hairdressers, beauty salons, and close contact services can open. Restaurants and pubs allowed to serve food and alcohol to customers sitting outdoors. So that's going to the pubs and restaurants in the outdoors. So that's, again, fantastic news. Gyms and spas can reopen, as can zoos, theme parks, libraries, and community centers. And members of the same household can take a holiday in England in self-contained accommodation.
Oh, that's good. That's good. Yeah.
I know. Weddings can be attended for up to 15 people, which can take place. And funerals can be attended for up to 30 people, which is 15 at wakes. Children will be able to attend indoor activity centers, and care home visitors will increase to 2 per resident. So that is now for stage 2. So stage 3 obviously is going to, so from the 12th of May to 12th of April to 17th of May, after the 17th, then we can look at the next phase. So in terms of the number of people, so it says 2 households or 6 people can meet. So if it's 2 households amounting to more than 6, that seems like you can.
Is it 6 for both households, or is it 6 per household?
So I think it's 6 people from 2 different households, not counting children under 11.
Yeah, but
So that's in Wales, but it doesn't say specifically in UK. So I'm not 100% sure about that, because it says
yeah, maybe
for us
we'll check that.
it says 6 people or 2 households can meet.
Okay. All right.
So
Or 2 households.
yeah. So if it's 2 households, I mean, if it's say 5 and 5,
And 4. That should be okay.
that's 9. Yeah. So it's yeah, I think it's going to be like, obviously, if you can justify that you are 2 households or 6 people.
Yeah. Okay. Right. Okay. Should we do the
Numbers,
now,
yes,
please?
yes, we can. So in terms of the numbers, we have today, yeah. So in terms of the numbers we've got today, is 132,437,230 positive cases. So that was my refresh figure. I'm just gonna. I think it might have changed. Yeah.
Yeah.
Yeah, 57. Yeah. So it's 132,000,000.
Yeah.
438,657. I thought as much when I saw it.
That's it. You got it.
Which is the correct figure as of today, this 6th of April. So total number of deaths is 2,874,344. Positive cases total recovered is 106,770,280. And the top 5 countries, USA is number 1 with 31,496,976 positive cases. That just seems like a large figure. But total deaths still standing quite very much the same, which is great news, which is 569,282. Brazil number 2 with 13,023,189 positive cases, with 333,153 deaths. India number 3 with 12,686,049 positive cases, with 165,577 deaths. France number 4 with 4,833,263 positive cases, with 96,875 deaths. Russia number 5 with 4,589,540 positive cases, with 100,717 deaths. And UK number 6 with 4,362 positive, with 62,150 positive cases, with 126,862 deaths. And following that, South Africa is number 19 with 1,552,416 positive cases, with 52,995 deaths. And
South Africa is doing quite well this day.
South Africa is doing really well. They're rolling out the vaccine.
All the way down to 19.
The numbers, it's gone down to number 19 in the world. So they've done extremely well. And in terms of the Ghana is 91 with 90,900 positive cases and 752 deaths. So Ghana is doing quite well also. And in terms of the 24-hour figures for the UK, following Easter weekend, we have the total number of deaths, Every Life Matters, is 26 new deaths in the last 24 hours, which is significantly reduced, and 2,762 new cases. So I think this is obviously looking at the figures, why they want to have, rapid testing. So to make sure that they are getting all the figures and preventing the spread of COVID-19. And then yesterday, the 24-hour figure was 10 new deaths with 2,297 positive cases. Yeah, and 10 new deaths the day before with 3,423 cases. And April 2nd was 52 new deaths with 3,402. So yes, so the figures have gone down. We are nearing our, the day that we've been waiting for. Hopefully, is coming very soon,
Yeah,
with zero
yeah.
deaths, zero
Deaths,
number of
zero
cases.
positive cases. Yeah, I'm
A
really
year
looking forward to that
later,
day.
a year later. So fingers crossed for the rest of the world as well, that we will be able to report such fantastic news. But as it stands, still stay safe, wear masks, use hand sanitizer, maintain social distancing, and look at the government website for the latest on the rules of what you can do from the 12th of April and do it safely. Let's spread the love and not the virus. And Apoko, again, happy birthday to Amy. Lots of love from
Yeah.
Freshly Fuddy, Shri Aryan and Sitara. And hope she's such a wonderful child. And
thanks for the gift, man.
oh, no, you're welcome. And hope she enjoys it. Hope she spoils herself with something nice, the teenagers, whatever she's into, something very nice and special.
She will spoil herself, I can promise you that. Did you hear the song I played for her just before we started, just before the COVID?
No, I didn't, because I was running up. I was
don't
getting myself. Which song was it?
It's a song called Daddy's Little Girl. I used to sing,
Oh, yes. I think
when she was much younger, she was
yeah.
9 or 10 or so, and I wasn't at home, a lot of times, and I would phone her most of the time in the evening. I would phone her, and then she would answer it, and then before she go to bed, I'll sing her that song.
Oh, that is so sweet.
So it's a very special song for me and her.
Oh, well, I'll have a listen now.
Yeah,
when you play.
Michael Bolton, Daddy's Little Girl. So I'm going to play that.
Oh, Daddy's Little Girl has grown up now. But she'll always be a little girl, though.
Well, she's my little girl, but
I know.
She's my little girl, Sometimes I feel like she sounds a bit more like my mother.
Oh, well, enjoy the celebration. It's a lovely sunny day. So whatever you're doing, hope you guys enjoy it and spoil her. And she has a fantastic lockdown birthday.
Thank you very much, Dr. Seshni Mulia. Thank you for joining us. And I'll see you tomorrow.
See you tomorrow, bright and early. Thank you, Poco. Have a fantastic day. Love from everyone. Bye.
Bye.
Thank you so much, everyone, for joining, and have a fantastic day. Stay safe wherever you are, and lots of love from my family to yours. Namaste, guys.